Hello, good evening, everyone. Can everyone see the PPT?
Yes, sir, it's
Good
loading.
evening, sir.
Yes, sir.
Okay.
Good evening, sir.
Good
Good
evening.
evening, sir.
Good
Thank
evening,
you,
sir.
Good
everyone.
evening, Dr. Jitesh.
Good evening.
Good evening.
Thank you, everyone, for joining us in such a short notice. And I'm glad that so many people have taken the initiative, actually spared time to learn something. And I'm very thankful for everyone. So let us start. The art of selection of homeopathic remedy. Homeopathy is completely on a practical basis. It's completely eye to eye. When you see the patient, when he walks, like as per mentioned, all the aphorism, I'm not going to give any lectures here, but to start specifically, I would like to say when the patient enters and sits in front of you, make sure you keep observing him, his pattern, everything, his eye, how it is, his build, everything, tall, thin, short. And when you take up the case, always consider his family history and personal history. So these are things are very, very important, which has to be considered while the case taking. So starting, I would like to start with the first aphorism. The high and only mission is to restore the sick to health to cure, as it is termed. So this has to be followed anyhow. We all know that we try our best and we have sometimes sleepless nights. If we don't treat, like our medicine doesn't work and the patient keep on calling, I'm not getting better, what to do, I'm not getting better, what to do. And I believe each and every one in this room has spent a disturbed night thinking what could be the medicine for that person. And I'm sure about it, because this is with everyone, with you, with me, any homeopath of this world, you can say, who really wants to help their patients. And believe me, our pathy has never failed, only we fail. So reason of our failure is the entry point in the case. When the patient comes, how we are trying to understand him well, so that our prescription should be precise. That is what I'm trying to show today's session. So in the next aphorism, second aphorism, rapid, gentle, permanent, remove the disease in its whole extent and occurs in the shortest possible time, unfolds in the least harmful way, based on well understood principles. So we have to give something rapid. Unless we give, like, if the medicine doesn't act, you have to change. You have to see, like, whether the patient is getting better or not, because that is the only way you can see your medicine is working or not, by patients word of mouth. And many patients, what happened, even if you're confident about the prescription, they are like, I'm not so better, but I'm better. Observe them more, whether your medicine is acted. Because what has happened, if in a hurry, you may change the right prescription to a wrong one. So you have to be confident enough whether what medicine you have prescribed and it matches well to the patient's constitutional or his symptoms. Coming up next, the very important aphorism, that is aphorism third, which you have to understand. What is to be cured? The homeopath must be able to clearly perceive what is to be cured. That is the only question we have to understand it well. What is to be cured in the patient? And these words have been emphasized deliberately as being able. What is to be cured? It's like, what is the important thing in this case? And the only thing is important, that is individualization. And what is curative? We have to understand what can be cured and what we cannot. We cannot be deliberate, like we cannot, like a lot of homeopaths like just claim bluntly, but they don't have that. And when they come to feedback, the patient is not well. So we should know what the prognosis should be. And for that, definitely the most important things come, that is knowledge of medicine, knowledge of disease is very, very important. You should know what you're treating and what you're dealing with. You should know the prognosis, either educate their attendant, don't say it directly to the patient, but definitely don't at least dishearten the patient as well, that you won't be able to help. Give him at least a positive hope. That is the biggest thing that someone can give. And coming to a doctor, our right is to give at least somewhat hope. Bluntly, we cannot say that we cannot help you. We can say we can try our best. Coming up next, how it is applicable. The choice of medicine, the dose, the strength, the quantity, the repetition, and for how long. The last, the remove the cause. I think everyone knows what is tolle-causum. Yes?
Sir?
Tolle-causum. Yes. So there are
Yes.
different type of obstacles such as lifestyle. And lifestyle, what had happened with him, what he's been doing all these days, that is very much important in the case taking. What he does as well. So that you can actually guide him. So these all the factors are very much dependent on your prescription. You have to teach him well that don't do this, don't do that. But for that, you should be knowing that what he is suffering from and what is the precaution has to be taken and the management part. This is a duty, you can say, every homeopath, every homeopathic physician should do this with their patient. Even if he's suffering from CKD, even if he's suffering from diabetes, give him a diabetic chart, give him a renal chart. It has to be done. Now, the most important thing where everything's get stuck, starting with the acute disease. In the 5th aphorism, in the 6th edition of Organon, clearly written, useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease. So I'll put it in a very simple way. For acute disease, any type of acute disease, there has to be some cause which has to be figured out in the case taking. Suppose anything, it might be like ailment from any exposure, cold, high altitude. I'll discuss. Like, there are two types of exciting cause. One could be physical, one could be psychical. So psychical causes and the physical cause, I'll describe you what type of causes generally happens. First, we'll understand the physical causes. Physical cause could be like effects of cold. Like you can say, when you take the case taking, and he might be suffering from anything, but you got to know he got the exposure of cold, after that it happened. So everyone knows the remedy, right? The first remedy which we think of,
Arsenic.
Arsenic.
Phosphorus and arsenic.
Great.
First arsenic, then
First is always arsenic. Always. Now it comes to effects of heat. Which remedy is worse, cold to warm? Tell me the first remedy. Let us be interactive so that
Diarrhea.
So once you get to know that he had a large amount of cold water and he got exposed in the summer heat, he's brainia. He might be suffering from anything. Anything. So you have to focus on only the cause. And then comes the effects of altitude. Tell me which remedy acts for high altitude sickness?
Coca.
Exactly.
Oculus.
Suppose a patient went some in a high altitude and he got something, might be deafness or might be anything, might be vertigo continuously. And you got to know that this person has traveled to Amarnath and he came back after that, or he traveled to Kedarnath, after that he coming, and after that he is not able to listen. Believe me, everyday practice, if somebody comes like this, and I get to know that he's coming from that trait. You give coca and make him sit and you'll see the result instantly.
Okay,
It's
sir.
that simple. But where is the error here? We are not being focused on the causes. We are only focused with the patient's history. Continuously history you are evolving. Whatever you're saying, okay, I'm noting it down. Noting is important, but what you are getting out of it, that is important. What you are actually receiving from the patient, that is what important. The partly answer is very reliable, partly is not. So you have to understand it very well, that what info you're trying to get out of it. One second, sorry. So next comes effect of rain. Tell me which is the first remedy which you think.
Rust off.
Rust off.
Rust off. Rust off.
Very good.
Rust
That
off.
is rust off. Tell me the next remedy in damp
Dalcamara.
patient.
Pulsatilla. Pulsatilla.
Dalcamara.
Dalcamara natrum salt.
Natrum self. Natrum self is the first. Next, tell me what is the cause when you come to know that patient has come from some seashore area. After that, he gets aggravated.
Chromium.
Natrum.
Natrum.
Natrium.
Next it comes when you get to know that some injury had happened. Then
Arnica.
okay.
Arnica.
Next comes etc. Etc. is personal physical history, which is very important. We'll discuss. So next it comes psychical causes. Tell me which is the first remedy which can come. Like suppose his father died and I had a cardiologic case. He got heart attack on the same day.
Ignatia.
Yes,
Ignatia.
Ignatia.
exactly. Ignitia. Ignitia is the first remedy. I'll tell you from a case example. What had happened? A 38-year-old guy. He just buried his father, who died due to heart attack, and he came back to the home, and suddenly he got heart attack. And his EF was around 35%. And once we started the medicine, it went down to 45 to 49%, and he's doing absolutely well. And the only remedy which I gave, that was Ignitia. As you all said, I was not different to think about it. I just focused on the cause, what has happened, how did he got the attack. If somebody gets a financial loss or a trauma, the first remedy which you can think of,
Calcarea.
Calcarea.
Arnica.
Arnica.
Arnica. That is a mental shock. The next remedy is due to fear. If suppose somebody met with an accident and you saw it in front of you, and after that you develop left-sided paralysis. Now,
Gelsemia.
correct.
Opium.
Opium.
Gels.
Opium.
Gels for shock. Shock. You have to catch the shock. Next comes indignation.
Staphysagria.
Tell me next, due to anger.
Colocin.
Colocin, chamomilla.
Chamomilla.
Mortification, sadness, forsaken, jealous. Most jealous.
Apis.
Lachesis.
Apis.
Apis.
So next, etc. So coming to the chronic disease point, these were all acute. I think everyone understood it well.
Yes,
So
sir.
these things
Yes,
have
sir.
to be focused.
Yes, Dr. Jitesh.
I'm not actually those who are not actually, you speak and then you mute yourself. That is much better. Yes,
So
somebody.
what about mortification?
Effect of mortification.
Wait, I'm muting everyone. Then whoever wants to speak, unmute and speak, and then unmute, mute yourself.
So effects of mortification.
Yes. Which remedy comes first? Holo, staff, and chamomilla. Suppose somebody has an insult and after that he got something pain in abdomen. What should we do?
Staphylococcus.
Right.
Staphylococcus.
Right. So these were the acute. Acute is generally, read this line for, and you should actually put it inside. What is the cause? For acute disease, you have to only find the exciting cause. And I showed you the physical causes and the psychical causes. It might be anything. You have to understand it well. What is the cause? So coming up next with the chronic diseases.
Sir, financial loss remedy.
Arnika is the first. So coming to the chronic case.
Sadness. Sadness. Effects of sadness.
Natramure, pulsatilla. So coming up to the chronic diseases. See, what
So
I'm
remedy
doing
for
is that
anxiety.
you have to work on this. My only purpose is to at least open the road to entry, that where you have to start thinking now, where we are getting wrong, why we are failing, why we are not getting good results. This is the way.
Yes, yes.
I have to clear your pathway. You have to work it. And this can be a detailed discussion that I can choose one topic, like what is actually intellectual character, how you can think about his occupation is suppose, mode of living, where he's staying. So these all points can be elaborated later on because a very deep thing. And you have to prepare yourself that you should be focused on only these kind of factors, which is very much important and clearly written in organon. This is not my teaching. This is clearly written by Hahnemann, and you have to just read one by word and you have to understand the inner core meaning of it, what he means. See, the first line already clearly written in chronic disease to enable him to discover fundamental cause due to chronic myasm in these investigations. The first thing is the physical constitution of patients, especially when the disease is chronic. Tell me, how many times did Hahnemann mention constitution word in theory of chronic disease? I don't know why people don't mute themselves. Tell me, how many times did Hahnemann mention? Anyone knows? 16 times. 16 times Hahnemann has only repeated only one word: constitution, 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 constitution. But still we are not getting this inside our head. The second comes is morale. Morale, what do you mean by morale? Anyone? What do you mean by morale? How can you see in the patient the morale? What do you mean by morale?
So the intention behind every action.
Some partly correct, but
How he, how he behaves to a particular situation.
How he behaves.
The behaviors. The behavior is very much important here.
Behavior of right and wrong behavior, sir. More
Right. How his character is, his intellectual, the will and intellect, his occupation, what he does. After that, he suffered. Mode of living habits. Like suppose somebody is living in a, you can say nearby a river, a nearby lake, and nearby something you can say, what do you call? Like all the drainage, all the dirty drainage. If somebody is living on the nearby dirty drainage and he gets marshy places, correct. So he gets an infection or a ulcer in his food. Tell me what we should actually think of the remedy. I'll make it very simple. No, pyrogenum.
Pyrogenum.
So again, the social domestic relations, like you know very much in India, everything is about social domestic relations, and every day you'll find a case with all the father-in-law, brother-in-law, mother-in-law, especially the mother-in-law and daughter-in-law. This all comes with this, and the sister-in-law as well. So these all relationship, how they are having any issues with mother-in-law, daughter-in-law. This is very important. His age, premature senility. Which remedy?
Fluoric acid.
Brita-carb.
Brita-carb.
Brita-carb is not for children. It's for old age senility.
Selenium.
Yes, selenium. But
Selenium.
to be precise, the premature senility word has been clearly mentioned well in Brita-carb. So premature means if he is 30 or 40, 30, and he's behaved like 60 or 70, then he's Brita-carb. But we are abusing Brita-carb in children like anything. So understand the meaning of what premature senility means. The sexual function, the suppression of sexual desires and everything comes. Now comes the etc. In etc. it comes family history, past history, intrauterine history, and PQRS symptoms, which is well defined in 153 aphorism. Even if somebody has an organon, they can read in 81 footnote the factors which is mostly considerable, that is climate factors, where he's staying, the slum to posh, the peculiar physical character, physical and mental training, abuse of business, matter of diet and regime, the passion due to ambition. Like a lot of I had to achieve a lot of things in life, but it is not happening. And since then, I'm very, very traumatized. I'm not able to work. I'm not able to think. This all things you have to see that somebody is sick due to their own passion. They're not able to achieve. Their manners, mode of acting, and the behaving, and the habit and customs of various kinds. Because in India, we have a diversity. We have every religion is different. Muslim cultures are different. Punjabi's cultures are different. We have so many different caste and their own customs and traditions. So as a doctor, as a homeopathic physician, I would ask everyone to know what their trends or customs have been there in the family, because it is very important in differentiation. You have to know, as you should have a knowledge, what they do, how they do, basic knowledge. Because this all small, tiny little information only can lead you to the right remedy immediately. Now comes to the principle everyone knows, like cures like, single remedy, minimum dose. After case checking, what has to be done? The symptoms of each individual patient, which is the most important part of work of the homeopathic physician, is to select only one remedy of the class and administer it. Now, the administration of includes everything: the size of the dose, the frequency, when to discontinue, when to resume, the medium in which has to be administered, that is water, alcohol, and especially the most part which we actually neglect, that is the auxiliary treatment. If suppose somebody is lack of vitamin B12, we don't have anything to increase B12. We don't have anything to for increasing vitamin D. This is all myth, huh? Even we have that vitamin D from St. George or any pharmacy, many medicines are there. It doesn't work at all. Vitamin D is vitamin D that can be only procured with the sun or through any multivitamins. Don't be in a dilemma that will give cell salts and everything will come up. This is not. Because for me, it never happened. And I don't think any of the stalwarts are there. For them also, it never happened. This is all myth. That you give cell salts and suppose you give natrum mure and sodium will come up, or natrum mure in the cell salt. This never happens. So you have to be sure that what is less, and you have to advise him to take multivitamins if something is less. Because in homeopathy, there is nothing a substitute. A lot of books has been written. You give for this potassium, you do this. This is absolutely rubbish. Nowhere in the Mater Medica it has been written. And we should focus on our Mater Medica books rather than interpreted things. Everyone which has been launched to other books name, and they have been telling it. This is all baseless. They don't have any evidence, because they don't know the proving. And these days provings are very difficult. It cannot be happened because it was done earlier, and we have lot of remedies which can be used everyday practice, and we can get marvelous results. It is not important that you should procure all the rare remedies in the in your lab and you use it on the patient. It is not at all important. You can be very successful practitioner on only 100 remedies. That can be also enough. but you should be knowing each and every core of each and every remedy when has to be given. And I hope I have already described the pattern which have to prepare the doses. I think many of the people know already, right? The taking of the dose in a
Yes.
poppy side pill in a 100 ml bottle. Yes,
जी.
the water dose, not the dry dose, because Hahnemann has already condemned in 6th edition that no dose should be given further. Only results are better on the dry dose. Why? Can anyone tell why the dry dose is not better and water dose is better?
Because there are more lots.
Because water dose is touches
How are-
nerve.
Okay. Tell me how our homeopathic medicine works? Through
Sentient.
Now,
parasympathetic nervous system, right?
sensitive.
So as soon as you take 1 cap of the solution of water, the tongue, as much is absorbed, that much medicine has been got in our body. That is finished. So if you give a pill, the only one part will be covered. But if you give a solution in a water dose, the complete tongue will get wet. Are you getting my point? Say yes.
Yes,
Yes, sir.
Yes, sir.
See, these all things not I am not invented it. You can refer to aphorism 247, 248 and you read organ and again you'll get the answers. This is not something which is very different I'm telling you today. This is all in the books which has not been followed. This is the only reason we are here with a Zoom session.
Okay, sir.
So how to select the remedy? Boger. Boger was a closest friend, or you can say follower of the Hahnemann, who actually know what is to be done in which cases. And he has been precisely, clearly written in his books of philosophy, in his collected works, in his writings, lesser writings. I think you should actually go to the each and every Boger teachings, read it, revise it, and will get all your answers which you are looking for. The first, change of personality and temperament. If there is any change occurred, the peculiarity of the disease, how the disease is there, the pattern, like especially the step ladder pattern typhoid, the seat of disease, like where, left, right, diagonally. Like he has clearly given example of sepia cures stubborn abscess of fingers and toes. This is why I have seen many cases treated by gangrene also by sepia. Concomitants, cause, modalities, time, periodicity, when it is worse, when it is better. Boger has clearly written. And the moon phases, not to forget, the moon phases are very, very reliable. Moon phases are very, very reliable. Don't ever think that moon phases are very, like it's a waste. It is very important. You should know.
Okay, sir.
Next, coming of the totality of the symptoms. Morning Hussain was a close follower of Hahnemann. And he was a gifted with a keen analytical mind which can grasp the essence of a problem that faced by a homeopathic physician like us. How to match the image of the patient with a drug picture in the vast Mathematica? That is the only question. So the first thing has to be followed. That is, nothing can be a known of disease except through symptoms. This is clear. Without symptoms, there is no disease, and without symptoms, we are helpless. Might be other can help, but we homeopathic physicians are helpless without symptoms. The second thing, always remember, it is the patient who is ill, not his parts or organs. So don't be so much prioritized that what he's suffering from, what disease he has come with. You listen to him. That is the first duty of a physician. Listen to him. Be very polite. Listen to each and every complaint. After that, just focus on what is your needs. What is the symptoms, how he is behaving, and what is to be given. The symptoms are only unfailing. This is clearly, it has been unfailing guide of the selection remedy. It's unfailing. And PQRS symptoms denote the similar remedy. And the remedy can hardly be ever be indicated by a single symptom, because at least 3 to 4 symptoms must be matching with your patient's condition. Don't rely on only one symptom and just prescribe blindly. unless you are very much confident about it. Now the concept of grand generalization. I'll tell you something interesting today. I don't know how many people know about it, but Bonning Hussain was severely attacked by Herring and Kent because he made things very simple. How? You all know what is to the part is?
True
to
to
the
the
whole
The
part.
whole body.
That's it. This is what very important thing is there, and don't ever forget. After Hahnemann, who has closely worked, I'll tell you that is Boger and Bonning Hussain. These two people have actually treated lots of cases which further people have also not treated. Read the source books of Bonning Hussain's and Boger collected works, lesser writings, you'll get a lot of things. But see how examples could be readily be cited of instance from the Materia Medica where the modalities in general sphere and in the local sphere have been conflicting type. Acha, tell me, is pulsatilla thirstless or thirsty?
Thirstless.
Thirsty and thirstless, sir. Both.
Thirstless.
Yes, sir.
Both because she's changing.
In acute, it is thirstless. Sorry, in chronic.
Pulsatilla is always thirstless, but at 2 p.m. it is thirsty. That is a peculiarity of pulsatilla. If 2 p.m. it's getting thirsty, especially if you're getting that point, that is pulsatilla. How many of you know this? It has been written in
Not
the
known, Dr. Jitesh.
It has been clearly written in the books that pulsatilla is thirsty at 2 p.m. only. So coming up next, the
Okay.
headaches of arsenic and phosphorus are better by cold. It is a contract, right? The painful piles of nux vomica and kalikaba are better by cold. But they are very, very extremely chilly remedies.
Chili.
The gastric complaints of phosphorus are better by cold drinks, although the patient in general is very cold. The joint pains of bryonia ameliorates by warmth, but generally bryonia is hot. So these all small information which has been done very precisely by the works of Boger, Bonning Hussain, please follow them very, very strongly. Even the Bonning Hussain's therapeutic book and Boger synaptic key, Allen's keynote, and Organon 6th edition. This much is enough. Materia Medica is the only key to similimum. Bonning Hussain is very firm on a point that a repertory is not intended to replace a diligent study of Materia Medica. Are you getting my point? We are always focused with repertory, rubrics, changing rubric statement. Nothing gonna happen. Believe me. Nothing gonna happen. Unless we don't correct our first step only, nothing gonna happen. Repertory comes at last. Unless your Materia Medica, what is the Materia Medica? What is the repertory? In the college, in the 4th year, it has been clearly taught. It is an index of a Materia Medica, the first line which has been taught. Everyone has read that. Index. Unless we know our Materia Medica well, how far we can go and search a remedy in a repertory? Tell me. See, computer repertories or everything, this is all GIGO, garbage in, garbage out. What you feed, you will get the answer. What you understood, that you put and you got the remedy. And there are 100% chances that you can be wrong. Because unless you do that also, but unless you go to the source book and read once the remedy, then you will be clear that whether I was right or I'm wrong. So don't rely on mechanical repertories or any repertories unless you're confident enough with your Materia Medica remedy. Our stalwarts, our gurus, you can say, are in history of homeopathy, everyone has condemned that. Don't be so confident enough on only the repertory values. Confident be on materias, because materias are the only source books where proving has done, where the sphere of action has been written, where everything is written. It is to be used only as an aid to memory when the knowledge of prescriber is not adequate enough to readily spot the remedy. So now he advises that the remedy that appears to be indicated or the group of remedies that come up for consideration should be selected only after proper reference to the Materia Medica. This is what I'm trying to say. The Materia Medica is everything. Forget about repertory. If you're not well versed with the Materia Medica, repertory is out of question, because the more we read Materia Medica, then only you can immediately say, okay, in the repertory there must be there. There must be there in repertory in that reference. Like it is written that cold to warm aggravation is there, then you can go to the repertory and you can find the chapter generalities, cold to warm aggravation, then you can find brainia and a lot of remedies. So unless you have read that word, how can you move to the repertory? So every answer is in Materia Medica. Now coming up to 152 aphorism. Take the individual symptoms and select those peculiar as your guide, and it will be astonishing how easy it is to prescribe for the case after you have taken it. That is where the trouble lies. Hahnemann has told us that anybody can prescribe for a patient after the anamnesis is well taken. This half the whole complete case taking. A well taken case taking is half cured. 153. Always remember what we need: the striking, the singular, the uncommon, peculiar, the signs and symptoms of a case of a disease, and are chiefly and most solely kept in a view. 153 aphorism, PQRS. It should be here. For it is more particularly these that very similar ones on the list of symptoms to the selected medicine must correspond to the order in order to constitute it most suitable for effecting the cure. The more general and undefined symptoms, loss of appetite, headache, debility, restless sleep, discomfort, and so forth, demand but little attention when that of vague and indefinite character, if they cannot be more acutely described, that symptoms of such general nature are observed in almost every disease and from almost every drug. Is somebody suffering, if somebody, suppose a small kid has got fever, like the viral is already on, that child will eat.
No, sir.
No, sir.
But patients are coming now. They're telling, my child had been sick, now he is not eating, give some remedy. It will take time. Unless his complete recovery happens, he won't eat. Are you getting my point?
Yes, sir.
So these
Yes,
small factors are very much important. Rather than spoil the case, you should understand well that what had happened in this case. Now, coming to very important thing, I don't know how many people know, but Allen has clearly mentioned everywhere that diagnostic symptoms are those of disease and the therapeutic symptoms go down to the patient himself. The more valuable symptoms are for diagnosis, the less valuable they are for the selection of the remedy. And the practice of homeopathy is just simple as a rolling of a log. It is so simple. And Dr. Allen has clearly written, it is the patient, not the fever, that is chiefly and specially to be considered. It is the individual with his, her or peculiar idiosyncrasies and the constitutional inheritance with which we have to deal. What patient is saying during fever, what he demands, suppose demands for a cold water, and suppose patient is demanding a cold juice, definitely your prescription could be acid phos only. That is the first thing to be thought of. Fever plus postation plus desire of juice, acid phos. Fever plus weakness and clinging to the mother and continuously crying and thirstless and demanding for a cold water. Sometimes, not always. Could be pulsatilla. Because pulsatilla loves cold water, and pulsatillas, each and every joint pain or anything is ameliorated by cold water. Even the joint pains, even the cold fermentation helps us knee. And how many of the people know pulsatilla's knee pain or pulsatilla any pain is walking ml? So only Rustox is not there in motion mLs. Pulsatilla is also in a higher grade. And another interesting point, Staph aureus demands cold water and they love cold water, yet in spite be chilly. So these are all small information which has been written in Materia Medica. If we read each and every day, it will be very much helpful in selection of prescription. So coming up next, he also emphasized the need of the family history as he announces the family history is much more suggestive of the curative remedy than the rapid pulse and high temperature. and should be carefully studied. This is where the point is. We have to understand what the personal history, the family history, this is all the important points. We have to consider it always. And it is said by Alan, not me. We have to just follow their teachings, which has been very, very effective and proven that they were the, you can say, the biggest physicians of their times. Even Alan condemned Kent like anything. He never agreed on Kent philosophy and everything. He actually, they never appreciated Alan's work and Boger and Bonning Hussein. So once you read Kent, I'm not criticizing Kent, but to be very honest, if you follow Kent, you will be on a different track all the time. You will see, whenever you read Kent lectures of mathematics, you feel that this is the remedy which I am looking for, and I myself, I have all the symptoms. How many times it happened?
Yes, sir. Yes, sir.
Many
Yes,
times.
sir.
Yes,
Always,
Most of the
always.
times.
Every remedy, I feel like this is for me only. If I
Yes,
take,
sir.
I'll be cured. So this is
Yeah.
where actually the dilemma, or you can say the confusion is. We are not reading. See, suppose somebody is coughing continuously and not getting better, and they are continuously retching, and they are trying to hawk, they're not getting better. Which remedy comes to the mind?
Lyco. Ipecac.
Yes, yeah. Yes, yeah.
Ipecac.
Which is this remedy?
Antimtar.
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 No, these all comes first. You're tired of giving everything. Now, what comes last? Focus katte. What is the word written here? Ketara. So this word katar, this word has to be understood well. So each and every in the Boger, each and every word, like colchicum. Read this line. What has been written? Cold and weak, but sensitive and restless. This is where the important point here is. We're not reading this. Cold and weak, but sensitive and restless. This each and every line.
Sir,
Any remedy you take. Colocynth, act on digestive tract, then longer on spinal nerves. This line. Sudden atrocious crampings, gripping pain, cramping, tearing. What is this first line written? Each and every remedy of Boger synaptic key. Each and every remedy. So you have to follow what has been written in the books, and precisely you will get the best results ever you could see.
So could you please show the cover of the book once? Camera पे नहीं आ रहा है. हाँ, got it. Thank you.
So coming up, the most important parts, you can say, everyone is like love to watch cases and learn. While making the PPT also, I was thinking that whether I should put the cases or not, but I added only because of one reason, that it should be a case solving session, because it is more like a workshop, you can say. So each and every one, all the 80 people, 79 people will tell me the remedy after the case. Then only I'll reveal what is one. Let us work together, because it is very, very simple. It is very simple. I am not, I have around 4 cases, right? Yes, I've kept 4 cases. It will be very interesting, and hope you'll all like it the way it is, the very simple thing. All it depends that how you take the case taking. So coming up to the first case, that is lumbar spondylosis. Male, 41-year-old, his MRI is confirmed degenerative lumbar spondylosis. He has a trouble of back pain since 3 months, more pain at left-sided, pain only in the lumbar region, no history of fall or injury, but he has prolonged bike riding for his work. Now he take physiotherapy, pain is intermediate, further consulted here. So pain in the lumbar region since 3 months, left-sided, onset sudden, sometimes pain start gradual decline, prolonged sitting aggravation, rising after sitting, bending forward, changing position, rising after sleep, hot water bag and cold application, more ml. jaundice, past history, gastric ulcer, anemia, family history, father hypertension, back pain he had on and off, physical generous habit, 2-time tea, gutka, gutka is tobacco, desire sweets, bowel is clear, perspiration profuse, sleep sound, unrefreshing, lying on sides, back covering. Mind, he was a single child, like playing more. How's your nature? Not anger easily, but feels irritable due to prolonged bed rest. Before I had a habit of work daily, but now staying home, which makes me slightly irritable. Mixing nature, helping nature, weep easily when hurt, when not talk with them, then who hurts me. Any incident, nothing. But if anyone ignores me, it hurts him. When any criticize, take it positive way. No other confusion, no confusion making any decision. But due to respect, I ask my father first. What do you think about your illness? When pains start prior, I felt nervous. Now I'm hopeful for the recovery after physiotherapy. But when pains get intolerable, then tear in eyes. Thermal, it's towards hot. Now tell me the remedy.
Sir, pulsatilla.
Okay. Surface area. Okay.
Surface area.
Put in the
From
chat. Put in the chat.
pulsatilla.
Put in the chat. Put in the chat. Pulse, RT. What else?
Will you please
Sulfur.
show the mental part?
Yes,
other
definitely.
person.
Definitely. Oh, sorry. Yes. The mental part. Okay. 1 second. Past history. That's physical, general, mental part. Yes. This one. This two. So this is a remedy. And I think only one people has answered, that is Dr. R. Tejasvi. So she was right. Now tell me how it was Rustux. I've already showed you the causes. Now I'll show how it was. No one was focused that, see, read this line. No history of fall injury, but he has prolonged bike riding for his work. Now this was ailment from over exertion. Like somebody get into the bus and they had a prolonged journey. After that, their back pain arises. That is always Rustux. Are you getting my point, everyone?
Oh, yes, sir. Yes, sir. Got it.
See, in repertoire, where it standard? On the fourth. What comes first? Phosphorus. And pulsatilla is also there, by the way. But what should we prescribe here?
Rustux.
The reason I'm putting preparatory sheet just to show I can be my own king. I can make the remedy come front. Because if I input more, I take some random rubrics more, I'll make sure that Rustux come first. See, I'm showing you where everything happens here. You have to be confident on your prescription that you have to consider. So I took only this. So LM1, 1 month, then 2 months, 3 months, 4 months. It was continuously 4 to 5 months, 6 months. He was LM2, LM3, LM4. I'm taking this follow-up video. Listen to him.
नाम क्या हुआ आपका? आपको क्या क्या प्रॉब्लम थी? अभी कैसा है? कितना महीना हो गया?
See. Coming up next. So and like everyone has understood my point, what I'm trying to show here. This was all focused with the cause. How
Cause is
did it
more
happen?
important. Right, sir? Cause is more important.
Yes, everything lies on cause only.
Sir, for chronic disease also.
Yes, but no, chronic disease, there are deep-seated. So definitely there has to be taken like each and everything. Like I showed in the aphorism 5, it has been written. The Myzem thing. Like you need to understand the well, his morale, his occupation. If suppose washerwoman, That will be the occupation. And she developed cracks in the feet. She's hands and feet are very cold. What remedy you can think of?
Sepia.
Yes, sepia.
Yeah.
Suppose somebody like her boyfriend is not being accepted in his family, and after that she's not having a good relation with his father, and his father said something to him. After that, she's not talking to anyone.
Natramute.
You all have the answers. I'm not teaching something
Ignatia.
different.
Exactly, sir. We are getting so easily after listening from you.
So you have to only consider these two things: exciting cause and acute disease. And the exciting cause could be two types of physical causes, psychical causes. And for chronic disease, you have to understand the moral, the intellectual, is occupation, mode of living, social and domestic relationships, sexual functions, is age, family history, past history, intrauterine history. Somebody has a recurrent, suppose somebody has given a dead child. What has to be given now?
Sir, repeat once again.
Somebody had a dead child, dead fetus.
So some animal group.
Which group? Which remedy?
So some animal group remedy.
That is where the mistake is, my dear friend. We are all grouping the subjects in different forms. There is no way. You should know only the remedy which is comfort.
Question, please.
If suppose a woman has bare a dead fetus or dead child,
Ignatia, sir.
semicifuga, actia resmosa. Actia resmosa is the only remedy. The woman who has bared a dead fetus. But due to shock, if the child died on that same day, then
Ignatia.
right, ignatia. See, you have to differentiate now. Gelsemium and ignatia both from the same family. But you have to differentiate. What was the effect? See, there is only one single right written which has been like I showed you in this case, the psychical cause. Where it went? Yes, 1 second. I showed you the fear, right? Due to fear, he developed paralysis. So everyone answered gelsemium very confidently. Fantastic. That is the only remedy. Lekin, what is the point here is, what in gelsemium, what has been written the first line? The muscle refused to obey the will. How did it happen? From the brain, he developed a shock. After that, he got paralysis. And why he got shocked? Because he saw someone being crushed in front of his eyes, or being murdered, or being anything. After that, they're like in grief. They cannot speak anything, and they're like paralyzed. That trauma occurred. How? We understand the process. Are you getting my point? This is where we have to focus. Am I clear? Because see, if for maybe in the next session I'll take this everything in detail, like in moral, intellectual, because it's a very huge thing to discuss. Each and every, how it is, the behaviors like calcarea carb, how you'll understand by by simply shaking the hands, how lycopodium, the firm handshake, this all behavior, how you will catch this, all everything is written in the books. I'll definitely teach you. Definitely. How you can understand calcarea carb, how you can understand lycopodium just by a handshake or just by this. These all simple things are very, very helpful. And this comes under constitution. They're built. Everyone knows natramute, thin neck, emaciated. Why not giving it? Why be focused on something other nonsense?
Sir, can you please differentiate the group of Ignatia and Natrum?
Ignatia will not at all speak. You can say they are totally in the trauma state. From the eyes only, you can be like, and you're asking questions. These all are practical teaching. Unless you like, if somebody is there next to me and the patient comes, I can definitely explain, because the day you will witness it live, you'll remember it for years. It is not possible all the time. That's why I encourage more of practical learning rather than online. But everyone demands, like, they want to sit there in home and they want, but everything's cannot be like served in a one plate. So you have to understand this, all practical things has to be learned by live here, by sitting. How can you see handsomers? Their all dress will be in an appealing sex manner. They will be appealing like attractiveness. Their way of speech, they will be like the way of expression will be like they are very much in need, that the way of their style of saying it, the style of expressing it, and they'll be like half of blouses or the exposed parts, naked desire to be. There you can say unsatisfied sexual urge. How will you describe? Unless you get the history, or unless the patient it is not in front of you, you'll not be able to decide what remedy has to be given. He might be suffering from rheumatoid arthritis. He might be suffering from anything. Doesn't matter at all. Why we are focused with the disease? Why we are not treating the individual? We're not treating the patient. We are only focused with the disease. Somebody is suffering from ovarian cancer and she is getting a lot of pain and bending double is amyloid. That is colosynth only. Why you are so much configured? Why you're so much confused? There is no any different like prescription for this. You have to take the characteristics and the modalities, and you have to just prescribe and see the results instantly at your clinic. Make the patient wait for 20 minutes next to you, or ask in the waiting room. You give the medicine, let him be there. Whether there is fever or whether there is anything, be there, ask them, you wait, because that much confidence. See, you'll fail 1 time, 2 times, 3 times, 4th time you will be right. Because once the patient has entered your clinic, he has entered only with the one hope that you can help him. And unless you do it, he won't appreciate it. So if you want, you should have that practice. You should start doing it. I know not success doesn't come in the like one shot. And it never came for everyone. Like, believe me, even the toppest of the homeopaths have failed in first prescription. Always. Never been a dilemma. Oh, he sees and he give it in one shot. Never. This never happens and never will be, because we are humans at last. We're not robots, or we don't have some imaginary power, or we can see and we can give directly. We may fail. It's okay. Human error can be happen. But don't be underconfident. At least try that. Yes, I should make him feel better, and I'll try my best to do that. No matter, okay, it's fail. Everyone doesn't get success at one shot. You may get better in the second prescription. But for that, you need that zeal to work on it. Then only you'll get the results. So coming up next, we already 9+. We have 2 quizzes. So everyone is clear with the Rustox?
Yes.
Coming to the
Yes,
sciatica
sir.
case, in Telegram group, we had a discussion. Female 26-year-old, 1 month back, one day suddenly the pain on lumbar region started. After that, consulting doctor, taking medicine, but she's not better. And problem started after C-section delivery, cesarean delivery. Left-sided sciatica, lying is aggravation, and she keeps leg upward, walking ML, lying on the fitted side ML, pressure ML, massage ML, dysmenorrhea also. Whole left hip is paining, extension from lumbar to hip to thigh to calf to the toes. Past history chickenpox and 1 CS delivery. Family history DM, blood infection, grandmother TB, grandfather family history, auntie DM, elder sister RA, elder sister a thyroid. Habit: rarely tea and coffee, tongue coated on the base tongue, aversion sweets, dreams sometimes not. Pain on lower abdomen during the menses, and pain remained for 5 days, and she can't tolerate. And she had a sexual desire around, out of 100%, she has 70 to 80%, she has a desire. Occupation, she was a teacher, but she stopped. Domestic relationship, she has a good marriage 3 years back. Anger, irritability, when not listen to her words easily, she gets a lot of suppression in anger. Critics, when somebody criticizes, she gets angry, but do not reply most of the time. She can weep easily, can weep in front of her, console, emulation, company desire, close to her sister, organized, like to travel in mountain area, fear of ghost and horror movie. So thermal is chilly, and ailments from after delivery. And this is the before.
नाम क्या है? अच्छा क्या हो रहा है? साइड में कहाँ से कहाँ
Kindly
तक?
don't take photos because it's a patient's privacy.
कब से हो रहा है ये? अच्छा ठीक है.
And guess the remedy, please.
Staphysagrine. It's due to lacerated wounds.
It is due to post-surgical operations. And she is offended easily, very sensitive. Suppressed anger also was considered. Then only stab. Only post-surgical operation was not considered. The other remedy which you can think of, there are two remedies which are highly prominent after post-surgical operations. That is,
Arnica.
yes, another one, bismuth. Bismuth is also, if you read bismuth, you'll get your answers. So coming up next after remedy.
अभी मेडिसिन लिए? हाँ. कितना बार? 4. अभी कैसा लग रहा है? अभी थोड़ा कम है. 100 में से कितना कम है? 50%. ठीक है.
Results are instant.
अभी मेडिसिन लिए?
So now case 3, severe pain in hemorrhoids. 55-year-old
Sir, what was the remedy?
staff. Now severe pain since 15 to 20 days. This patient is already taking biocombination R13, no relief. Patient during visit. She cannot sit. It's in terrible pain.
ଚାଲିଲେ କେନ୍ତା ଲାଗୁଛି? ଆହୁରି ପେନ୍ ଅଛି ଚାଲିଦେଲେ? ମାଛ ମାଂସ ଖାଇଛ?
Walking also aggravates his pain. So, severe pain, restless, bleeding drop by drop, hard stool after burning sensation, itching sensation, pricking needle pain, stool after stool it gets aggravated for 2 to 4 hours, sitting, standing, walking, everything aggravates. Suicidal thoughts due to severe pain, tingling sensation on both limbs, weeping tendency due to pain, gastric since 30 years, have a cigarette habit, desire rasgulla, chena, mango, tongue is reddish white, stool pain in upper abdomen, dullness feeling on abdomen, no desire to eat, only gets perspiration scanty, sleep is 5 to 6 hours refreshing, stool is hard, strength needed, constipation is there, no desire to eat, drink alcohol, he has all the lifestyle habits. Occupation, he sits on electric shock. Anger, very much anger, destruction, harm to himself or others. After feelings, he feels guilty that what he has done. Company desire, straightforward. He is sad because he was cheated by a friend. Easily emotional, does not weep. Religious, tension about marriages, children, about health, suicidal thoughts during pain. Now, thermal.
Looks vomica.
Arsenic, sir.
Very nice. What more remedies you can think of?
Muriatic acid.
Nitric acid.
Nitric
Looks
acid.
vomica.
Asculus.
Congratulations, who told muriatic acid. C. Hemorrhoids, sensitive, painful, they cannot even sit. And the warm water ml is always acid, always acid mu. Warm water application is always acid mu, and it never ever fails. Might be some potency problem, but it never ever fails.
So, but arsenic is also there, no? Ameliorated by warmth.
Correct, but the prostration and the weakness that was covered well with acid mu. Arsenic people will be like they will be like in the flat position and they'll be like restless. He's also restless, but he wants to sit, but he cannot sit. Arsenic people will be in more anxiety. Like it might be not like they might the amount he has sat in front of a doctor asking people won't even start. He'll come in the clinic, he'll be downstairs and he'll say, help me, I'll die, doctor, I'll die, help me. This is arsenic. Arsenic cannot even walk and enter to your cabin if he's in an acute state. China people can come to your clinic, but acid force won't even able to walk. He'll be in so much prostrated state. 2 people, 3 people will carry him. This is what you have to understand. This is only the practical teaching can help. That way you can learn remedies and can never forget. This is a follow-up.
अभी कैसा लग रहा है आपको? थोड़ा कम है? पहले जितना दर्द हो रहा था? कम है? 50-60%. अच्छा, अभी बैठिए तो पहले कैसा लग रहा था बैठने से? हाँ? नहीं बैठ पा रहा।
See, he
अच्छा,
was not
अभी?
able to sit. Now he can sit.
अच्छा, ठीक है। अभी और कैसा लग रहा है? और कुछ लग रहा है? दर्द लग रहा है थोड़ा सा। ठीक है।
This is where acid mure works. And this is where we do. Case 4 psoriasis. This is okay. We have 5 cases, I guess. Yes, we have 5 cases. So we have to finish it off quick. I think, is everyone in hurry? Or should
No,
I?
sir.
No, sir.
No, sir.
Definitely.
No, sir.
Okay. So there are 5 cases actually. Case 4 psoriasis. Female, 47 years old. Psoriasis since 1 or 2 years. She's a housewife. She took homeopathic medicine, no improvement. The observation was cleanly seen kindness, sympathy, and she was nervous, anxiety about trifles, history of psoriasis, both palm and those that were palmo-plantar psoriasis, itching when touch any object, morning skin dry, skin hard, cracked, scaling when scratch the affected area, better when applying any moisturizer. That is commonly for every psoriasis patient. If they moisturize, they're better. Past history, migraine, renal stone, hypertension, chickenpox she had mild fever 4 months back. Family history, father diabetes, mother expired by the heart complaint, paternal uncle also expired by asthma, grandfather Lynch pain, maternal grandfather also hypertension, sisters suffering from hypertension, gallbladder stone, diabetes, brothers also suffering from hypertension. Habit, Gudaku, she was doing in childhood. Sorry, but she's since 35 years, she's avoiding it. Desire salty and sweet. Aversion chili food, plain milk. Due to smell, she doesn't like it, the milk. Thirsty, she takes 10 liters of water. She's extremely thirsty. Limbs, nausea tendency. When head pain gets increased, she gets vomiting tendency. Skin, psoriasis, palm and sole when dry, sweating profuse on face, palms, soles, and they also get white stain present on the clothes, mostly on the summertime. Patient telling about her nature, she's anxiety about trifles, mild sympathy to whole family, affection with the whole family, very softness for the family members, not want to hurt others, good relation with the neighbor. She solves all types of problem between the families, irritation when she has to repeat again and again, easily anger but suppressed. When husband ignores her, she get indisposed to talk. She doesn't feel like talking when she gets anger, lot of anger, due to when husband neglects. Fear of losing loved ones, religious, weep easily when hurt others. Like animals also, she feel bad. After consolation, she feel better. She wants consolation. Company desire, cleanliness. She does work in gardening in free time and punctual. Ailments from her husband, health issue, stress because the husband travel all the time. And when she listened about her son affair with a school classmate, she got hurt, but she never expressed. That where the history is. Thermal is hot. Now tell me the remedy.
Graphitis. Graphitis.
Graphite is extremely chilly.
So sulfur.
Sulfur.
Tetramure.
More.
Phosphorus.
So carcinosin. Carcinosin.
Very nice.
Silesia, sir.
Silesia is the chilliest remedy, my friend. This is a totality. Now tell.
Sir, Natramure.
Natrum uraticum.
Natramure. Yes, I am right, sir.
Natramure. So This is the feedback.
नाम क्या है? निर्मला साहू। क्या हो रहा था आपको? सोराइसिस की प्रॉब्लम था, हाथ पैर दोनों फट रहे थे, बहुत खुजली भी हो रहा था और खुजलाने के बाद फट भी रहा था। ये कितने दिन से था? मेरा 1.5 साल से चल रहा था। अच्छा, अब कैसे कितने टाइम यहाँ से दवाई ले? अभी ये तीसरी बार है। 2 महीने हो गए ट्रीटमेंट होते, तीसरा बार आई हूँ। अच्छा, अभी कैसा है आपका? अभी मेरा ठीक है। और हाथ में कहाँ पे हुआ था? हाथ में, मेरे दोनों हथेली में
See your
हुआ,
hand completely clean.
दोनों पैर में तलवा में हुआ था और उससे बढ़ भी रहा था, आगे आगे भी कुछ जा रहा था उसका। अच्छा, अभी यहाँ के ट्रीटमेंट कैसा? ट्रीटमेंट के बारे में क्या बोलेंगे? यहाँ का ट्रीटमेंट सुपर है।
So now she's becoming like a podium. Praising.
का नाम क्या है? Can you please show fatality?
Yeah. Yeah, this one. Nitromure, excessive sweat, and they are extremely thirsty. Hangnails also there. And that will teach in Mathematics. Nausea, headache during. Desire, salty and sweet nitromure is very marked. Ailments from grief also considered.
So do we have before picture?
का नाम क्या है? निर्मला
No,
साहू।
before picture, I'll share in the Telegram.
हाथ पैर दोनों फट रहे थे, बहुत खुजली भी हो रहा था।
She was in terrible state. She had all the cracks. See her hand. I'll share in the Telegram. Okay, case 3, trigeminal neuralgia. I think many of the people have seen in this case. The reason I added because it was very important to show, and those who know the remedy, please don't answer it. Those who doesn't know, please answer it. 69-year male suffering from since 4 years, already taking hydrocodone, arnica, ilium cepa, hypericum, and he was a slight better in arnica. He had myasthenia gravis in 2010. Then he take treatment. He feels better now, but now since 4 years, he's been diagnosed with trigeminal neuralgia. He has domestic stress in childhood. After his grandmother's death, his stress increased. I had no good relation with my father. My father did not listen to me. He dominated him and gave priority to his brothers. He was the eldest one. 4 years ago, he felt current-like sensation as a 440 volt in left-sided upper jaw at the premolar teeth. After it took treated by a dentist, dentist extracted his tooth. After that, current-like pain remains same. After he consulted to neuralgic doctor, he was diagnosed with terminal neuralgia. Terminal neuralgia since 4 years, location left-sided, on-site sudden, come sudden, go sudden, but it's severe and sharp pain when started. Current-like pain as if electric-like. Now it feels difficulty in chewing food, and current-like sensation started left upper jaw, radiate to the whole side of face, more sensation at tip of nose, upper lip, swelling in the left side lower jaw after the laser treatment. Current-like sensation, slight touch aggravation, chewing aggravation, lying down aggravation, lying on the right side aggravation, drinking aggravation, eating aggravation. Everything is aggravation, only mild pressure when putting hand on the face. That's quite common with trigeminal neuralgia patients. Burning sensation in the left buccal cavity when eating. Heaviness feeling in the tongue with a burning sensation in the tongue. Past history, myasthenia. Family history, mother OA. Physical generals, pan, desire pani puri, sour, before he was fond of sour food. Aversion, most of the vegetables, he cannot eat chili, feel burning in the mouth, urination clear, but sometimes burning when taking any painkiller, frequent at night 3 to 4 times. Extremity, trembling of both hands, sweat moderate. Mind, after marriage. I did love marriage and I'm happy with it, but not good relation with brothers, and they blame me that I had affair with my cousin. My wife influenced with it. Now my wife do not believe me, but I love her a lot and I can't bear her suffering. I took immediately her hospital when she gets ill. How's your nature? He was completely asking that, please get me all right. He was begging for recovery because trigeminal neuralgia patients are in excruciating pain, fear of operation and injection. Even he cannot see others who took injection because of the stress. He cannot go to the doctor, and sometimes he do self-medication. Loquacious. He has no sister, but he likes to talk with girl, with a female with affection. He completely believe in homeopathy. He brings many hospital. He has bought a lot of hospital, but he never came himself. But anyone shouting at me, I get quiet because I know there's no profit to quarrel with others. I know nothing would happen after nothing will happen after argue with them. So he has a habit of staying quiet and bear the situation. So before, I feel better when I stay away from my family member. When anyone talk nicely to me, I can do anything for them. Emotional, sensitive, he cannot bear others' sorrow. I thought if anyone can get profits in his business, what he earn, he does job outside. My thought not match with my son, but my daughter-in-law loves me and take care about me. My staff care more about my son. I feel my son do not listen to my advice. I feel hurt to it. He has a conflict with his son all the time. He has that is the history. He has always conflict with the sun. Thermal chili. Anyone wants to tell the remedy?
Staph aureus.
Sir, Silesia.
Stapes.
First you
जलसी में
first you say.
और क्या होता है तो पेन होता है झटका टाइप का कहाँ पे ठीक है
After treatment. This was instantly done in the hospital itself. Any family dispute can raise this
आपको
pain.
20 मिनट में कैसा लगता है पहले कैसे आया तो कैसा था जब आया तो मुंह से आवाज नहीं निकलती थी जब आया तो नहीं आपको मैं सलाह दूंगा बिल्कुल आप उनको पकड़ लो कस कैसे
So staff was given. Whoever answered that was correct. Now his take, the staff was followed. He's on LM5 now. And this is the 2nd August, the latest follow.
क्या नाम है सर
Since 2 months, he hasn't got
क्या नाम
attacked.
है क्या हो रहा है
अभी प्रॉब्लम दूर है थोड़ा ठीक लग रहा है जो ये जो करंट मारता था
अभी ठीक है
हाँ ठीक चल रहा
100% से कितना परसेंट ठीक है
है 50
दवाई खाने से पहले कैसा था
नहीं उससे पहले प्रॉब्लम नहीं था अभी 1.5 महीने से भी प्रॉब्लम नहीं
हुआ है
That is the power of homeopathy. All trigeminal patients cannot even stay quietly during pain. So the last case RA, female age 43 since 2019. Always do exercise. I was active. She was even climbing mountain, but after that mild pain in the right side foot. But after that it gets increased. And then she consulted to the allopathic doctor. Doctor said that she has RA and she took injection, but she did not continue it. After that, since 2 years, she's taking homeopathic medicine. Also, she did test and she has allergic to gluten, lactose. She also taken 3 steroids and she also has a asthma tendency. She also removed 26 gallbladder stone since 5 months. There was a pain, redness, swelling, hot when touched. And I also have gouts on the fingers of right hand and it was bent at that time. Now it is okay. She's also doing magnet therapy 2.5 since 2 months. She thinks that pain has been reduced. Now, whenever there is pain, she takes painkiller. So complaints, chief complaints, pain, RA, bilateral foot, only painkiller helps, swelling. She has asthma after delivery, cough, or due to cold aggravation and antibiotics only relieved her, gastric complaints. And this is the before treatment.
क्या हो रहा है आपको मेरा र्यूमेटॉइड आर्थराइटिस लास्ट 3 साल से है उसके लिए मुझे बहुत पेन रहता है पाँव में चलने में भी प्रॉब्लम होता है अच्छा पहले डॉक्टर को दिखाया था लास्ट 4 इयर्स हुआ मेरा डॉक्टर्स डिफरेंट डॉक्टर्स को दिखाया लास्ट दिल्ली एम्स में दिखाया तो उन्होंने मुझे इंजेक्शंस बायोलॉजिकल इंजेक्शंस के लिए बोला वो मैंने लेना नहीं चाहा तो उसके बाद से 1.5 साल हुआ मेरा होम्योपैथी ट्रीटमेंट चल रहा है दिल्ली में अच्छा अभी भी पेन हो रहा है अच्छा चलने पर पेन पता चला थोड़ा चल के दिखाइए नॉर्मल कभी चल नहीं पाती चलने में पता चल जाता है कि पेन है बोल पाँव में अच्छा अभी भी क्या है
So past history, thyroid, RA, cough, and college doctor that she's suffering from asthma. Early marriage, first baby at 19 years, then 10 years age gap, vomit a lot during first pregnancy, tubectomy, fall from scooty, chickenpox, malaria, UTI 2 times, family history, cancer, paternal metastatic cancer, mother has RA since 40 years. So you're dealing with an autoimmune disorder, which is also a hereditary trait. Desire fast food, sweet, banana, fruit juice, gupchup, that's pani puris. We call gupchup here. Spicy, milk products, aversion to kundru, lactose and gluten. It aggravates her pain. Hair and skin gets worse after steroids. She used to take that. Thirst 3 liters, tongue dry. Red moles are also there in the body. Perspiration, neck, sleep, dreams violent, and she sees all the time she gets that snake is biting it. Snakes are biting her. I know might be she gets that, but it has been written. Education, PG she has not completed it because due to family and children she cannot do any job. Love marriage, that was intercaste, married 25 years back, 2 children, relationship with husband is good. They don't have so much of sexual desire. Price on light, BP usually get low. It's all about family tension. Tension about health, property distribution also good going on. Easily emotional, easily weeps, alone weeping. Emotionally hurt, cleanliness, fear. She has that fear that I'll get bitten. Believe me, every RA patient knows that they'll get bitten. So this fear is very common. So never consider it. Everyone that knows that RA, then they have that image comes in the mind that I'll get crippled. So that is, they leave it. So about health, when there is a pain, what will happen? What will happen? She has that anxiety. Thermal is hot. So anyone can tell me the remedy?
Lachesis.
Lachesis.
Sir, it's lachesis.
Benzoic acid, sir.
Sorry? What remedy? Type in the chat box.
Lachesis, sir.
Lachesis. Okay. Any more suggestions? So everyone agree with the lachesis? Done?
Yes, sir.
Pulsatilla. So Dr. Amar will give 2 remedies, lachesis and pulsatilla. Stick to one.
Sir, lachesis only, sir.
Okay. This is totality. Now, what is the remedy?
Sir,
Medorinum.
Medorinum, sir.
Totality. After seeing the totality, everyone will come to remedy. It's very
Yes,
easy.
sir.
Let me tell you, Medorinum is thirsty pulsatilla. If you find pulsatilla and you find thirsty and you find sleep on niches position, sleep on abdomen, it is always meadow. And this dream snake bitten by, I got in complete repertory. There was Medorinum, surprisingly. I don't know why I searched it, but I searched it and I found out meadow. But earlier that I was confident that this is meadow. And like I saw that in the repertory, it was meadow, but somebody given by some unknown Hershroff, some author, I don't know who, but it was there.
Sir, repeat once again difference between Medorin and pulsatilla. Just now you got
Thirsty pulsatilla. Thirsty pulsatilla is always meadow. Read Catherine Coulter, my dear friend. I am sharing each and everything, but there is no value of it. So unless you read the books, you won't even get, because this all information I also got from books only and from the teachers which I am sharing it today. Because unless you have that knowledge that, okay, I have to be best, you have to read each and every remedy precisely. So after Medorinum, this is the follow-up. And lastly, the given was LM4.
आपका नाम क्या है? मेरा नाम ज्योति गुप्ता। क्या हो रहा था आपको? मेरा रिमेटॉइड आर्थराइटिस था। लास्ट 3 इयर्स से मैं सफर हो रही थी। यहाँ मैं लास्ट 4 मंथ्स में कलेक्ट हुई हूँ। उसके बाद ट्रीटमेंट के बाद विदिन ए मंथ मेरे को पता चल गया, इफेक्ट पता चल गया। अभी मैं काफी ठीक हूँ। मेरा वो पहले जैसे आर्थराइटिस पेन भी नहीं है। मेडिसिन मेरा चल रहा है। कितने टाइम से ले रहे हैं मेडिसिन? मैं मेडिसिन ले रही हूँ 3 मंथ से वक्त किया। अच्छा, अभी कितना परसेंट आपको बेटर लग रहा है? मेरे 70% बेटर हो गया है। यहाँ के हॉस्पिटल के स्टाफ।
So this was the outcome of Medorinum. I'll tell you, Medorinum is a very, very, very deep acting remedy, and Medorinum is always considered with the autoimmune diseases when they have multiple complaints. Also in the family history, there will be DM or cancer. And the most confirmatory point I also see with the carcinosin Medorinum, that is the red moles in the body. That is the precisely confirmed point. And believe me, the red moles is given by Boger, has clearly mentioned that red moles will be there if he is meadow. Even the carcinosin has it. Medorinum people are also have arm hairy. They can be like more of arm hairy, and you have read tuberculinum and Medorinum. These 2 remedies are always hairy body when you find in the lumbar hair also. So not carcinosin is not much so hairy, but tuberculinum and Medorinum are hairy. So done for today. So keep in mind, we can consider the Bonning Hussain as a founder of the scientific prescribing in homeopathy. Herring, Kent, and others who followed have not been able to appreciate the breadth of this vision and tried their best to demolish them. They have always tried their best to demolish them. But these two people has everything in their books if we read it. And I can say precisely that everyone used to stay away from these two subjects, even BBCR. Usually in college days, everybody like, who will make the repertory sheets of BBCR?
Sir, what about boric?
Boric is more of pathological, but these people have made things simpler compared to Boric, compared to any author you can say. Because if you follow them, it will be, your prescription will be very easy. Because these people have clearly, precisely written each and everything in their books. What aggravates, what ML, what modalities are there, everything in the written in Bogus Anaptiki and Allen's chemo. Even BBCR, the BTP book, you can every remedy you can find, any section you can find the comparison, the contraction after inflammation. There are so many remedies. So with falling, there are so many remedies. So there are so many remedies that every remedy has their own action on that. But you have to be confident enough that what remedy you are thinking of, or what remedy is the patient leading to you. Then only you can prescribe on that basis. These all books are references. All you have to apply is your brain. And the brain you have to apply only while the case taking. So everything is case taking. Unless your case taking gets improved, you're not better in a prescription. You will never be better in prescription unless you improve your case taking. So case taking is must. Everybody selected art of selection of remedy they have to learn, but I was expecting everybody who should have focused in art of case taking more.
Okay, sir.
This topic, but the main part is the case taking. Anyways, I have given you everything. The exciting cause, the acute disease, the chronic disease, I've explained you, and more in further sessions. I'll definitely try my best to get in more depth so that will be more precise, because that will be a longer session, and in 1 hour that won't be possible.
Sir, when can we expect next session, sir?
Very soon, very soon. I'll try my best to do it. Right now, I already have a material session to finish it off. I'll definitely try my best, and I'll try to do it the aphorism 5 in detail, as well as the constitution is a very thing important, and then we'll follow with the mice. So we'll do it. I sincerely request to please share your feedback in the Telegram group. So whatever you learned, what was the main thing, or how you felt, what was the experience, because I have made things very simple. And from tomorrow, please, when you take the case taking, just in acute disease, it's a very simple. Find the exciting cause. In chronic disease, you find the levels, his moral, his intellect, his cause, where he lives, personal history, family history, everything. So these two things have put in a, put in brain, you feed it well, that what you have to do in this case and what you have to do in this case. Very simple.
Okay, sir.
Sir, please take a lecture on case taking someday.
I'll definitely do, but the irony was that everybody wants to read how to extract the remedy fast. Nobody wants to learn the first step. Everyone is hurried to become a good doctor, but it takes time. It takes time.
Jitesh. Thank you.
Thank you so much.
Thank you, sir. Thank you so much, sir.
Thank you for
Thank you very much,
being
sir.
Thank you.
Thank you, sir.
Thank you so much.
Thank you, sir.
Good night.
Good night.